Hi guys, this is Mishak Mate, and then the channel is Unpacking with Mishak Mate. So today I want to talk about something that was sparked by Operation Dodula. I think it was 2 weeks back in Hillbrow, where they were turning foreigners away, saying they don't deserve or they can't be helped, more especially in our hospitals and clinics. So like I was curious about the matter, and then I started researching about this particular matter, and then I've realized that in Nigeria, Zimbabwe, and Ghana, like their hospitals and clinics are only reserved for the locals. They don't help foreigners. If you are a foreigner, you are in that country, it means now you must go to private sector where you are going to pay. But here in South Africa, our government is taking us for a ride. Our constitution need to be amended because now it allows for foreigners to get your primary health care. So in other countries, like I've mentioned, Nigeria, Ghana, Zimbabwe, they don't do that. They're not playing, guys. Their budget is only reserved for the locals, not foreigners. But in South Africa, we want to act as if we have the same resources as your USA, your UK, where they can actually manage to can do that. But in South Africa, we have limited resources, guys. I remember before I had medical aid, I think I went to Edenville Hospital in Edenvale, where I think I was supposed to go undergo a scan. They needed to scan something on my body, and then I think it was April. They said I must come in November because now the dates were were filled. So I'm like, oh guys, it means I will even die like before I could come here in November, because imagine it was April. It had to be May, June, July, August, September, October, November. I'm like, oh, by then I will be dead. Most they'll be like, ah, there's nothing we can do, brother. We have limited resources. So imagine in that list there are foreigners who are filling those dates. Imagine from April to November. So guys, I think our constitution need to be amended, because the Nigerians and Zimbabweans are demanding something which in their countries is not happening. So imagine we are being taken for a ride by foreigners and our government. So they really need to amend the constitution ASAP, because we cannot go on like this. I don't blame those Operation Dodula guys when they're preventing foreigners from entering our clinics and hospitals, because really, guys, like we have limited resources. At least they must meet us halfway. They must go to private, because there by private they will pay. There are no queues there by the private institution, so they must go there and leave poor South Africans to go freely to their clinics and hospitals. So I think it's not fair. I don't know what you think. Do comment on the comment below, and then I'm gonna play this other video where these foreigners, or the forum of foreigners in South Africa,
describe the scale and impact of what's happening on the ground right now at some of these public hospitals.
Thank you very much. Good afternoon and good afternoon to the viewers. Well, look, this is growing. I mean, it started maybe at a relatively smaller scale, but seeing what has happened, in other hospitals, including in Soshanguve and Durban, this is growing. And unless it is abated, because you can see that we've seen that happening initially in Gauteng, but now it is in Durban. And this shows that now it's becoming countrywide. We know that it has also happened at some stage in Bulukwane, but now we can see that it's gaining traction unless, proper steps are taken to enforce the law and ensure that, these groups that are resorting to self-help and vigilante groups are obviously taken to task. This is going to grow and embolden other people that might think it is the correct thing to do.
Now, do you have an idea of the numbers of individuals that have been impacted or that are being impacted by this process?
Well, I mean, apart from the numbers that, obviously we get from various publications, but we have seen from video footages, quite a lot of people being turned away. So, I mean, I might not really say that these are the numbers, but as a result, we have seen some of the, even some of the clinics where people would ordinarily go becoming very, very empty instead of actually having, people, attending, clinics. And we have seen in Soshanguve at some stage quite a good number of people in Outreach, a good number of people, tens of people being turned away. So the numbers is unconfirmed, but obviously it is clear that we've got probably thousands of people that have been turned away this far.